Hi, I'm Jerry Setek with Dr. Daniel Clark of the Macomb Spine Care Clinic. I'm going to turn it over to Dr. Clark to talk to you a little bit about the StandRite-Pro.
Hello, I'm Dr. Clark. I'm not a paid actor. I own and operate the Macomb Spine Care Clinic, where we take care of patients with low back and leg pain, mostly caused by bulging, herniated, or degenerative disc disease with spinal stenosis. One of the things that we do here is physiotherapy along with spine decompression. Many of our patients cannot sit, they cannot stand, and even lying down is very, very hard for them because the leg pain is so intense. One of our patients yesterday, who could stand but not sit or lay down, said that it looks like it's impossible for him to have treatment because all he can do is stand. Well, it made me think of the StandRite-Pro that we have at our front desk, helping our receptionists get relief from standing and postural stress. Well, I brought it into the physiotherapy room and I positioned the StandRite-Pro underneath the physiotherapy table and lifted it up high, and he was able to use that StandRite-Pro and receive 30 minutes of electrotherapy through his leg and down his leg, and laser treatments, and he had no problem standing for 30 minutes. And this is a man with serious herniated ruptured disc and low back and leg pain. So we completed the treatment, and he said it was very comfortable for him. I was amazed. It takes pressure off the low back, the buttocks, the leg, and the feet. And I was just amazed to see him complete 30 minutes of treatment standing up and bending over a table. This morning he came in and he said, "You know, Doc," and he went on and on, "I have to tell you that last night was the first night I've slept all the way through the night in over a month and a half."
Wow.
He said that feels better than he ever has, and even his leg pain is reduced greatly because he was able to receive the treatment and then get a good full night's sleep. And that, to me, is real success and amazing. And I owe it to that StandRite-Pro.
Well, wonderful. That's great to hear, Doc. Where do you see it moving forward? Do you think you have a use for it in the practice, or in at least with your receptionist? How are they doing?
Well, they're doing fine. As a matter of fact, she uses it constantly. I mean, I don't know that I could take it away from her. She would get very angry if I took it away from her, because she uses it every day. I could recommend it to cashier checkout patients who stand all day in one spot, people who have to stand at their machine shop at one spot, and of course, any patient of mine that can no longer lie down or sit down because of their low back and leg pain. I'm going to recommend that we do the new Clark method, which is stand over the therapy table with a StandRite-Pro under your legs and knees, and you'll be just fine.
Well, thank you very much, Doctor. It's been very helpful. We appreciate you taking the time to and the interest in the StandRite-Pro. It's a big deal for us. Thank you.
My pleasure.